Medical professionals recommend children 12 and older get the COVID-19 vaccine.
Kimberly Kurth talks with local doctors about how parents best weigh that decision.
Children's Hospital Physician-in-Chief Dr. Mark Kline says a decision about a COVID vaccine is like a decision about any other vaccine.
You weigh the benefits versus the risks. And in the case of the COVID vaccine, for children 12 years of age and older, it's felt that the benefits far outweigh the risks.
Right now, medical experts recommend children 12 and older get the COVID-19 vaccine.
We know that children can become infected with COVID. We know that they can become sick, very sick with COVID, although at a lower rate than adults. And we know that they can transmit COVID to susceptible adults. So to get this pandemic under control, we really need to immunize adolescents and children.
When weighing the decision of whether to vaccinate children against COVID, LSU Health licensed counselor and family therapist Dr. Kimberly Frazier recommends parents have an informed conversation with their pediatrician and also an honest discussion with their child and ask for their input if they're old enough.
I would tell parents, one, when you're weighing that, you need to be honest about what you know, what you don't know, right? What the expectation might be. If you do decide to vaccinate, having that conversation about what that looks like. I think the other thing to be really cognizant of is to think about your child's age, their developmental stage, when you're having those conversations so that you're at their level.
Another consideration that may affect a parent's decision to vaccinate their child against COVID-19 is how soon they'll be able to return to their normal activities.
If the child is playing specific sports or doing outside activities, investigating what is it gonna, as you would do anything that you put your child in, investigating what's the requirement. If the requirement is vaccination, again, thinking about that.
Certainly COVID has stressed all of us from a behavioral health perspective, adults and children. And the best way to get back to normal for children and for adults to go back to their routines as they had them before, to be able to get together in groups. In the case of children and adolescents, to go to camp, to go to school in the fall without undue concern, is to be vaccinated.
Kimberly Kurth, Fox 8 Local First.
Dr. Kline says children under 12 are currently getting the COVID-19 vaccine in clinical trials. He says that data may be available in the not too distant future, and he expects by the end of the year there will be approval to vaccinate younger age groups.